Welcome, and thank you for your interest in the results of the annual Fairfax County Youth Survey for the 2016 2017 school year. The Fairfax County Youth Survey provides data to county, school, and community based organizations to assess youth strengths and needs, develop programs and services, monitor trends, measure community indicators, and guide countywide planning of prevention efforts. The survey is comprehensive and covers many topics. Some examples are alcohol, tobacco, and other drug use, mental health, bullying, nutrition, physical activity, and sexual health. The survey is anonymous. No identifying information for the student is stored with the results, and it's voluntary. Students are instructed that they may decline to answer any of the questions on the survey or may completely opt out of taking the survey. Students are asked questions about their behaviors, experiences, and the risk and protective influences in their lives. Questions are mainly taken from the Monitoring the Future survey and the Centers for Disease Control and Prevention's Youth Risk Behavior Surveillance survey, where we get national comparisons when they're available.
Complete results from the survey can be found in the reports on the Youth Survey website. There are more questions asked on the survey than are covered in this presentation. The 2016 Fairfax County Youth Survey was completed by close to 47,000 Fairfax County Public School students in grades 6, 8, 10, and 12, representing 85% of enrolled students in those grades. Sixth grade students take a shortened, modified survey. Where available, sixth grade data are referenced in this presentation. More detailed information can be found in the sixth grade report on the Fairfax County Youth Survey webpage. Data from the Fairfax County Youth Survey show how having just 3 assets, also known as protective factors, gives students the tools they need to build resilience to respond to life challenges and make healthier choices. 6 assets from the survey were chosen to see how they relate to teen behavior: having high personal integrity, performing community service, having teachers recognize good work, having community adults to talk to, participating in extracurricular activities, and having parents available for help. Through the Fairfax County Youth Survey, we see that the more assets youth have, the less likely they are to engage in risky behavior, whether it's sexual activity, alcohol use, marijuana use, bullying, carrying weapons, binge drinking, cigarette use, or gang involvement. The more assets a child has, the lower their risk. For example, of youth who report having none of the 6 assets listed, 34% drank alcohol in the past 30 days. Of youth who report having 3 of the assets, only 17% drank alcohol in the past 30 days. Of youth who have all 6 of the assets listed, only 9% drank alcohol in the past 30 days. Assets, in a combination of both individual characteristics as well as environmental factors, facilitate and foster resiliency in youth.
Let's look at the survey results for alcohol, tobacco, and other drugs. Students were asked if they had more than a sip of alcohol in the past 30 days. Overall, 15% report that they have. This is lower than the national average of 20%. Unfortunately, alcohol use is much more prevalent as students get older. Almost 1/3 of 12th graders drank alcohol in the past 30 days. 1 in 6 female students reported drinking alcohol in the past 30 days, which is slightly higher than male students. Approximately 1 in 5 white students report drinking in the past 30 days. This is higher than other races and ethnicities. Binge drinking is defined as having 5 or more drinks in one sitting in the past 2 weeks. Fairfax County rates are lower than the national average. Binge drinking rates are comparable for both female and male students. Similar patterns exist for binge drinking as for drinking alcohol.
Similar to the pattern of alcohol use, Fairfax County youth report lower rates of marijuana use than students nationally, with rates increasing by grade level. Approximately 1 in 6 12th graders used marijuana in the past 30 days, with Fairfax County students reporting lower prevalence than their counterparts nationally. Male students are more likely to use marijuana than female students. Rates vary by race and ethnicity from 4% to 11%. Synthetic marijuana use was significantly lower than marijuana. Inhalants are volatile substances with chemical vapors that can be inhaled to produce mind-altering effects. This includes a variety of products common in the home, such as spray paints, glues, aerosols, whipped cream cans, and cleaning fluids. Use rates are very low overall and are lower than or comparable to those reported nationally. In addition, the highest use rates are among sixth graders for this dangerous behavior. The survey questioned whether students used painkillers or prescription medications without a doctor's order, and it was discovered that the misuse of these drugs is even more prevalent than smoking. As with other drugs, use increases as students get older. Smoking among Fairfax County youth is less prevalent than it is nationally, but the pattern is the same. Students are more likely to smoke as they get older. Cigarette smoking rates decreased from 2015 to 2016, and overall are less than 1/5 of what they were in 2001, when the first Fairfax County Youth Survey was administered. Similar patterns exist for e-cigarettes as for regular cigarettes. However, like their counterparts nationally, Fairfax County youth are more likely to use e-cigarettes.
Looking at drug use for sixth graders who take a shortened, modified version of the survey, it is revealed that inhalants are the most prevalent drug used. Overall, 2% report using inhalants in the past 30 days, more than alcohol, cigarettes, or marijuana. A closer look shows that students of all other races and ethnicities are more likely to use inhalants than white sixth graders. Fairfax County Youth Survey data show a young person who engages in one risky behavior is more likely to engage in other risky behaviors. Let's take alcohol, tobacco, and other drugs as an example. Students who report using alcohol, tobacco, or other drugs in the past 30 days are more likely to report having sexual intercourse, bullying and cyberbullying others, and attempting suicide than students who had not used alcohol, tobacco, or other drugs. In addition to asking students about their behavior, we asked them about their support systems. The good news is that the data shows us what parents think matters. Students were asked if they thought their parents disapproved of them drinking alcohol. Of the students who perceived their parents thought it was very wrong for them to drink, 93% did not drink alcohol in the past 30 days, compared to 46% of students who perceived their parents thought it was not wrong at all.
The Fairfax County Youth Survey asked students questions about stress, depressive symptoms, suicide, and unhealthy weight loss behaviors. Students were asked to rate their average level of stress during the past month on a 10-point scale, where 1 means no stress at all and 10 means a great deal of stress. Students who reported 8, 9, or 10 were considered to have high stress. Over 1/3 of Fairfax County youth reported high levels of stress. Unfortunately, prevalence increases as students get older, with almost half of 12th graders reporting high stress. Female students are significantly more likely to report high levels of stress than male students. Rates vary by race and ethnicity from 31% to 39%. Students were asked, during the past 12 months, did you ever feel so sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing some usual activities? Over 1 in 4 students report depressive symptoms in the past year, and rates increase by grade level. Though the overall rate of depressive symptoms in Fairfax County is 26%, a closer look shows that female students are affected at a much higher rate than males at every grade level and for all races and ethnicities. This is a pattern we have also seen with past national data. Almost 40% of Hispanic females report depressive symptoms in the past year. When asked about suicide, 14% of students report seriously considering suicide in the past year. Over 1 in 6 female students have considered suicide.
Students who report attempting suicide is 5%, but the rate is higher for Hispanic youth and youth of other or multiple ethnicities. Female students are approximately 90% more likely to attempt suicide than male students. Through the Fairfax County Youth Survey, we see that positive influences in students' lives make a difference in depressive symptoms, suicide, and feelings of stress. For male students who report having all 6 of the protective factors listed, the rate of depressive symptoms is only 7%, compared to 43% for those who report depressive symptoms when they have none of the protective factors. Likewise, for female students who report having all 6 of the protective factors listed, the rate of depressive symptoms is only 13%, compared to 62% for those who report depressive symptoms when they have none of the protective factors. We can see that having protective factors in their lives makes a profound difference for our youth, especially in the case of girls as it relates to depression, suicide, and stress.
Unhealthy weight loss behaviors include using diet pills, powders, and liquids without a doctor's prescription, fasting for 24 hours or more, and either vomiting or using laxatives to lose or not gain weight. Overall, 8% of students have used unhealthy weight loss methods in the past 30 days. This equates to approximately 4,700 high school students in Fairfax County Public Schools. Female students are affected at a much higher rate than males at every grade level and for all races and ethnicities.
The survey also asked students questions about the food and beverages they consume and the amount of physical activity they get. Childhood obesity is a national concern. Unhealthy nutrition and physical activity behaviors are linked to a variety of chronic diseases, such as cancer, stroke, diabetes, and heart disease. Youth who adopt good physical activity and nutritional habits are likely to be at a healthy weight and be on the road to lifelong good health. Students were asked a series of questions regarding the fruits and vegetables they ate in the past 7 days. Almost 1/3 of 6th graders eat 5 daily servings of fruits and vegetables, but the percentage of students meeting this goal decreases with age. There is no difference between female and male students. The percentage meeting nutrition requirements by race and ethnicity vary from 20% to 26%. Students were also asked a series of questions regarding the beverages they drank in the past 7 days. 1/3 of 6th graders drink at least 1 sugar-sweetened beverage per day, and this becomes more prevalent as students get older. Male students are over 50% more likely to drink sugar-sweetened beverages daily than female students. Youth reporting drinking sugar-sweetened beverages daily by race and ethnicity vary from 26% to 47%. It is recommended that youth get an hour of physical activity every day. This graph shows the percentage of students who get an hour of aerobic activity 5 or more days in the past week. Over half of our 6th graders are active at least 5 days a week, but the percentage decreases as our youth get older. The percentage drops 15 percentage points from the 6th grade to the 12th grade. Half of male students report getting 5 or more days of aerobic activity per week, while approximately 1/3 of females report the same rates for physical activity. Students of races and ethnicities other than white are less likely to get at least 1 hour of physical activity 5 days or more a week.
Screen time is the time spent on the average school day watching TV, playing video games, or using a computer or other device like smartphones for something that is not schoolwork, including Facebook and other internet activities. The more hours students spend on screen time, the less opportunity they have for physical activity. More than 3 out of 5 Fairfax County youth get 3 or more hours of screen time on the average school day. That rate increases to approximately 70% and higher for Black and Hispanic youth. In recent years, screen time use has shifted away from watching TV and more towards playing video games or using devices and the internet for non-school related activities. Recent research has linked inadequate sleep with a higher risk for childhood obesity. Approximately 1/3 of Fairfax youth get at least 8 or more hours of sleep on the average school night. This varies widely by grade, with approximately half of 8th graders getting at least 8 hours, but about 1/3 that rate for 12th graders. Students were asked about their experiences in areas such as bullying, cyberbullying, harassment, teen dating abuse, and gangs. Fairfax County students were asked whether they texted or emailed while driving in the past month. Over 1/3 of 12th graders reported this dangerous behavior.
Students were provided the instruction: bullying is when one or more students tease, threaten, spread rumors about, hit, shove, or hurt another student over and over again. It is not bullying when two students of about the same strength or power argue or fight or tease each other in a friendly way. Students were asked to respond to questions about whether they had ever been bullied and if they had ever bullied anyone else on and off school property. These questions were introduced in 2015, so comparisons to rates of bullying in 2014 and earlier years should not be made. Being a victim of bullying was most prevalent amongst sixth graders, with almost 1/3 of students reporting being a victim. Bullying peaks in the 8th grade for bullying others. Approximately 1 out of 12 8th graders report being a bully. Female students are more likely to report being the victims of bullying, while male students are more likely to bully others than female students. Electronic bullying is bullying through email, chat rooms, instant messaging, websites, or text messaging. Though cyberbullying can be devastating due to the number of people that can be reached instantaneously, the student-reported prevalence of cyberbullying is lower than that of traditional bullying. Female students are more likely to be victims of cyberbullying than male students, but are comparable to male students for cyberbullying another student at their school. By race and ethnicity, the prevalence for cyberbullying others ranges from 4% to 6%, and the prevalence for being cyberbullied by others ranges from 8% to 13%. Students were asked if anyone said something bad about their race or culture, or if they had done the same to anyone else. Sixth graders report a lower rate for this behavior, with only 18% being the aggressor, but it jumps significantly to 30% by the 8th grade and 36% by 12th grade. Looking at racial and cultural harassment by race and ethnicity, white students are less likely to be harassed based on their race or ethnicity, but students of all races and ethnicities report about the same for harassing others.
Students were also asked if they had been sexually harassed in the last year. Overall, 13% of youth reported being a victim of sexual harassment. However, female students were much more likely to be a victim than male students. Students were asked several questions related to unhealthy relationships. Teen dating abuse is often associated with physical injuries, but before you see bruises, there may be other warning signs that a relationship is not healthy or safe. Unhealthy relationship experiences increase by grade level, with over 1 in 4 students in 12th grade reporting experiencing at least one of the following in the past year: having a partner in a dating or serious relationship who always wanted to know their whereabouts, being pressured to have sex when they didn't want to, and being a victim of verbal and/or physical abuse. An estimated 2,950 high school students in Fairfax County Public Schools are affected by physical dating abuse, while approximately 4,200 are affected by verbal abuse. Male and female students report roughly the same for experiencing controlling behaviors and physical abuse, but female students are much more likely to experience verbal abuse or to be pressured to have sex when they didn't want to.
While the youth survey is not the ideal tool for measuring the number of gang members in Fairfax County, it can tell us a great deal about their lives. Youth who report ever being in gangs show increased risk across all aspects of their lives, including their school, family, and community. Students were asked if they had been physically forced to have sexual intercourse when they didn't want to. This question was not asked in the context of a dating relationship, and it should not be assumed that the aggressor was a current boyfriend or girlfriend. 4% of females report that they had been physically forced to have sex. Males reported half the female rate.
Students were asked questions about sexual behavior in order to identify health-related issues. Overall, 17% of students report that they have had sex. This increases by grade level. Over one-third of 12th graders have had sex. There is considerable variation among races and ethnicities, ranging from 8% to 25%. The prevalence of oral sex is slightly higher than sexual intercourse in almost every demographic category. Condom use is an important measure of sexual health from the standpoint of prevention of both pregnancy and sexually transmitted diseases. The majority of students have never had sex. For those who are having sex, more are using condoms than not. Countywide, 66% of youth who are sexually active report using a condom at last intercourse. Lastly, contraceptive use is more prevalent for older students. 86% of sexually active 12th graders use some method to prevent pregnancy at last sexual intercourse, compared to 81% of 10th graders and 69% of 8th graders. Overall, 17% use no method of contraception at all or cannot identify the method of contraception used.
Students were asked questions about various assets that impact resiliency and likelihood of engaging in risky behaviors. Building resiliency in youth is critical to their ultimate success and enjoyment in life. Fairfax County and Fairfax County Public Schools believe it is important for families, schools, and communities to provide needed supports for youth that foster resiliency. One model for fostering resiliency in youth is the Resiliency Wheel developed by Nan Henderson, founder of Resiliency in Action. The wheel identifies 6 resiliency builders, or external protective factors, that can be provided by families, schools, and communities that mitigate risk factors and build resiliency. These resiliency builders are: increase pro-social bonding, set clear, consistent boundaries, teach life skills, provide caring and support, set and communicate high expectations, and provide opportunities for meaningful participation. Research has shown these 6 resiliency builders to be effective in helping our youth successfully meet the stress and challenges they face in their lives. To learn more about the Resiliency Wheel and the 6 resiliency builders, visit fcps.edu/resources/student safety and wellness/mental health and resiliency. Looking at selected assets that families can provide to build resiliency, we see that the majority of Fairfax County families have parents who are available to help their children, are aware of where their children are when they're not at home, allow children to provide input on family decisions that affect them, provide a home environment where members are respectful to each other, and show disapproval of marijuana use by youth. These assets each have an impact on risky behaviors and together build greater resiliency. For example, of youth who report having none of the 5 selected assets, 57% drank alcohol in the past 30 days. Of youth who report having 3 of the assets, only 20% drank alcohol in the past 30 days. Of youth who have all 5 of the selected family-based assets, only 10% drank alcohol in the past 30 days. Learn more about the assets that schools, the community, and all of us can help youth acquire in the Building Resiliency in Youth Through Assets video on the Youth Survey webpage. The data show us that when we give our teens opportunities to be involved, offer supportive relationships, and recognize their good work and accomplishments, we give them the assets to help them make good decisions and become resilient to risky behaviors. Above all else, it is vital that youth have at least one caring, trusted, and supportive adult relationship in building resiliency. Adults can decide to be the one, whether it be from the family, schools, or community. Adults should ask youth how they are doing in school as well as life in general. By listening and providing support, especially when things aren't going well, youth will feel like they are cared for and know what they do matters. When youth are doing well, providing praise and specific feedback is better than just saying, "good job." In addition, giving youth opportunities for meaningful participation and pro-social bonding helps build a feeling of community. Helping youth set goals that reflect positive thinking and a belief that they can be successful is important to increase performance, achievement, and well-being. Finally, setting clear and consistent boundaries provides youth with explicit rules on the expectations of behavior. Fairfax County youth who reported that their families had clear rules, especially about alcohol and drug use, also reported that they were less likely to engage in risky behaviors. As a community, we can work together to address attitudes about substance use. Attend a Unified Prevention Coalition Saturday Night in the Suburbs presentation to learn the facts about teen substance use. Parents can set and enforce consistent expectations and rules about drinking and drug use with their teens. Parents can also limit availability of alcohol, tobacco, and other drugs. Store and dispose of prescription medicines in a safe and secure manner. They can also take the pledge to chaperone alcohol-free parties. Learn more about the Parents Who Host Lose the Most campaign by visiting unifiedpreventioncoalition.org. We can increase awareness around mental health issues by taking free online suicide prevention training or becoming certified in mental health first aid, both available through the Fairfax Falls Church Community Services Board. Visit fairfaxcounty.gov/CSB to learn more. We can also program the crisis text number into the phones of our students who attend Fairfax County Public Schools. Students who find themselves in crisis can text "Need Help" to 85511 from their cell phones for immediate help and access to mental health resources. We also must address bullying and cyberbullying before and when it occurs. Visit stopbullying.gov for tips and resources on this important topic. You can also download the No Bullying app for conversation starters with youth and strategies to prevent bullying for various age groups among children and teens. And finally, parents and the community should support youth in improving their nutrition and physical activity habits. As a start, limit screen time and encourage outdoor play and physical activity. You can also use My Plate as a guide for meal planning and limiting processed foods. Visit ChooseMyPlate.gov to learn more. Please visit the Prevention Toolkit for more ideas and opportunities on how you can take action in your family and community. You can also view detailed topic-specific presentations on substance use, bullying and cyberbullying, teen dating abuse, depression and suicide, or nutrition and physical activity. The Prevention Toolkit also provides resources for these topics. View the toolkit at fairfaxcounty.gov/ncs/prevention/toolkit.htm. To learn more about the Fairfax County Youth Survey, do more in-depth exploration of the Youth Survey data, or view the full report, presentations, survey instruments, fact sheets, and videos, visit fairfaxcounty.gov/youth-survey. For questions regarding the Fairfax County Youth Survey, email sophia.dutton@fairfaxcounty.gov. For questions regarding intervention and prevention services in Fairfax County Public Schools, email dd.baylor@fcps.edu. Thank you for your interest in the Fairfax County Youth Survey.